So Danielle, I heard something about yoga. It was a statement. I'd love to hear your thoughts on this. It, again, definitely piggybacks what Dr. Ojo Cairns just said about how yoga from a neurological standpoint is taking the body into, and this would be more like higher level positions or balance poses, taking the body into a stressful position and then teaching the mind to relax there. Mm-hmm. And isn't that that's kind of what we have to do sometimes with our chronic pain patients is say, okay, yes, there's stress. Can we teach your mind to relax here? Because that changes the brain.
Mm-hmm. Absolutely. One of the practice techniques that I found that I'm bringing to my students more so in the past year or so, I'm not teaching really any differently than I did pre-pandemic, but just as we're talking here about our own body awareness, I'm tuning in more into different stress levels and different things that my students are dealing with. And what I found is focusing in on kind of a repetition and stay, because sometimes it can be scary to ask students to be still, no matter what age, no matter what, if you're teaching math to fifth graders or yoga to middle-aged women like myself, right? Telling folks to be still can be really scary, right? That's something that we don't, I know we were talking earlier about self-care. We don't often give ourselves that time. And so finding ways, even at your desk, we're seated so much at Zoom for many of us, or we're on our feet, finding moments throughout the day to engage that root lock, lengthen the tailbone, draw the thigh bones in toward the hips as you point the knees away from you, and keep breathing, but kind of hold that tilt of the pelvis up and the tailbone down and release it, keep that repetitive motion and keep maybe moving with your breath, and then maybe hold that root lock. And again, it's easier said than done, but that's one example as it ties to today's practice. But to answer your question, Erin, of kind of that activity and physical movement of yoga, and then maybe sometimes more what we might think of as more complicated standing balance postures that then help us get out of our mind, or out of that, the sensations of the mind, the monkey mind that sometimes we say in yoga, to find ways to have repetitive movement coming into triangle, out of triangle, before finding a few moments in that stillness. So whether we're talking about engaging root lock or a balancing tree. The other night I led a baby version of tree where we turned one knee out and pressed our heel into the other ankle, and we still had both feet on the ground, and that's still our tree pose. We still might have swayed a little bit, and then halfway through the practice, I encouraged folks to maybe slide their foot up their leg just a little bit higher if they felt like it. And then by the end of practice, we did a third round of tree where some students were able to draw their leg up toward inside the thigh. And that's an example of a pose where you find different versions of it to see what's most supportive for you. And it also engages root lock if you're mindful of that and drawing that downward energy up, that kind of, so it's grounding and lifting up at the same time. And hopefully that answers your question a little bit.
No, I love it. I love it. And I often will, I'll work with a patient on finding that core and finding that ability. And then I will, and you'll probably appreciate this, because then I'll say, and then you take that into tree pose. Then you become mindful of that in tree pose. So,
and that's a wonderful standing posture to practice strengthening the pelvic floor. And again, I'm not giving any medical advice here. Clearly, always check with your doctor to make sure that you're ready for a certain yoga practice or a particular posture. If you're working with any type of pain or injury, of course, always check with the doctor first. And then as you build that strengthening, you might start to, feel a little bit more confidence in how you're grounded and centered.
I just want to take a moment to interject that if you haven't practiced yet with Bhav Brigade, it's so lovely because there are lots of different places to practice. There is not a concrete brick and mortar studio that you walk into. It's available at lots of outdoor locations, and you can find that information on their website or follow them on social. I've been able to do some even through Zoom in the pandemic, and that's been its own challenge because I've had, children on me windy, or I've been at BOV classes when I've been outside and in the sand and the wind is blowing. So poses that I thought that I had when I was inside with no, in the luxury of a time where I was undisturbed by any outside thing, I thought I had it. And then you get a gust of wind or you're on sand and it shifts you. And all those offer different opportunities to do, I think, Erin, what you were hinting at, which is you practice it, but you also want to practice it with a little bit of difficulty, because that is part of the practice. And that is how we bring it into our lives as well. It's how we relate to difficulty, pain, or external difficulties that we might experience. All for the support of ourselves. So definitely, if you haven't yet, the other thing I wanted to mention about BOV Brigade that I love is that the classes are donation based, and a portion of those proceeds always go to a different organization that the instructor has chosen, and they let you know that up front. So I think that's just such a cool thing.
Thank you for promoting BOV. That's really sweet.
I'm just such an organic fan. It's so easy. It's easy to promote all the things that I love. I've been thinking a lot about, if you're going to pay for it now or you're going to pay for it later, do you want to do something, preventatively now so that you're not having to deal with the repercussions later? So it seems like this is something that I don't even really want to ask the question, why should we do this now? Like that we feel threatened into taking care of ourselves now, but what things might we, what positive things might we experience if we're taking care of that, we're taking care of the pelvic floor and engaging in these sorts of activities?
I think there are a lot. I think, first of all, just feeling happier. Let's just start there. This is outside of the pelvic floor, being able to sleep a little bit better. So then this is us bringing in just yoga and wellness. I'll let Erin and Danielle go through the gambit of all the other positive things that you will feel in your pelvis, but just overall, I think just you'll feel a bit more whole overall. That's the benefit and a reason to start now, not wait till later.
So that's one of the things I love about Dr. Ojo Cairns is that approach to total body wellness and the total person, which is why we're doing these types of talks. I would say from a purely bring it to the pelvic floor perspective, when you start early with good pelvic floor care, you can prevent a myriad of problems. So one of my big soapboxes is that we don't talk about the pelvic floor because of the functions of the pelvic floor. So from a purely anatomic system, it is bowel, bladder, sexual function, as well as core stability. So these are all things that are so important for quality of life. And I would also say that for women, we get into quantity of life because women will stop participating in exercise when they have pelvic floor dysfunction. And so that creates a whole other different type of healthcare disaster. If I'm leaking when I run, so I stop running. If I'm leaking when I exercise, talk about pain with intimacy. I have pain. I've had 2 children, and now I have pain with intimacy. So I kind of, rather than talk about it, kind of shut off from my partner. How does that impact the bigger picture of women's lives? So because we find it, unfortunately, there's some shame around these topics, loss of bladder control, loss of bowel control, constipation, pain with intimacy. So dealing with those things earlier rather than later, we know can make a huge difference. And just talking about it, saying it's okay to say this because so many women are dealing with this. Dr. Ojo Cairns, how many women do you see, that are dealing with these issues?
I would say upwards of 80-90%. In all honesty, I think a lot of people, women in particular, but I'll say people in general, don't really put into play how important it is to have a pelvic floor that functions well. And also how important it is to actually address issues that you have, as opposed to putting them off to the wayside. and how important it is to do things that are preventative, to help prevent having certain types of issues. So I would say for pelvic floor dysfunction, about 80 to 90%, and that might be kind of skewed because I'm a GYN. So, but that being said, I have a lot of women that walk into the office and there you have, they believe their issue is here, but it's totally something else that is contributing to that or making it worse. But when we come back to what the actual root cause is, oftentimes there's a component of pelvic floor issues.
One other thing to add to that, I know that Dr. Ojo-Cairns already mentioned that connection between physical health and mental health, that when we're taking care of our physical body, more often than not, right, we're also taking care of our mental health. You mentioned happiness. And then also what Erin mentioned, I can't tell you, Erin, how many times I say pelvic floor in my yoga classes as it connects to what we're discussing here of those ancillary effects when we're focusing in on the attention of pelvic health. And I don't use the phrase pelvic health in my classes, but when we're doing lunge poses, for example, if you have one knee down and your front knee is bent, and often what I see in my students, because again, there's this image-based kind of Instagram yogi image that we need to be really dragging our hips down, reaching that front knee forward, arms to the sky, like full on back bend. And what I'm noticing is people are really dumping into hip flexibility and not engaging the pelvic floor. And so, again, I'm not an anatomy expert by any means. It's not one of my strengths as a teacher, but I'm really benefiting from this discussion. Is I will tell my students at least 2 or 3 times within one sun salutation sequence, let's slow down, engage the pelvic floor, lift the hips up a little bit, kind of don't deepen the bend of the knee so much. And as you're paying attention to what's happening with the pelvic floor, you're recruiting other muscles, like we talked about earlier with the core, and you're not collapsing into that hip flexibility. And as far as preventive yoga medicine goes, then you're more likely to reduce injury to your hips or to your knee or to your back if you're paying attention to that pelvic health floor.
So for people that are novices or just have no experience at all with yoga, what's one way to become engaged? For those especially that may have a fear of joining or being part of a yoga class.
Absolutely. I encourage folks, first of all, I know that Hannah has shared some of the links to Bob Brigade. I know there's other wonderful donation and accessible yoga platforms out there. So if you know a yoga teacher or you have a friend that practices yoga, start with someone that you trust or that you know. I know not everybody is on Instagram or Facebook, but many of us have websites to see where are some accessible places, because I do realize that it can be intimidating to go into a studio. And right now we might not feel safe going into a studio. So I think finding a place that you feel comfortable in going with a friend, starting online. From our BOV page that Hannah has shared, I do believe we still have a link to YouTube, where at the beginning of the pandemic last year, I think we put up about 10 to 15 videos that are for beginners all the way to intermediate and longtime yogis, where what I tell my students is to go with what works for your body. Props are good. Our bodies are our best props. So always find an expression of a pose or a non-pose, right? Sitting or reclining and focusing on your breath and moving more as a teacher instructs you if that feels good for you. But I do think that that establishing of trust and knowing that you've got some ways, whether it's online or going with a friend, to kind of dip your toes in the water of trying something out, because we won't know till we try. But it is a real lived experience that many folks don't feel, for various reasons, welcome in a yoga space. And it's on us as yoga teachers and yoga practitioners to invite folks along and cultivate that space of inclusivity for all bodies, regardless of ability. And sometimes that very real fear of, oh, I'm not flexible enough or I'm not strong enough. As you practice, you start to build that mobility and build that strength. And again, then building the confidence that helps with our mental health as well.
May I also ask you, for pregnant patients, is there a time in pregnancy that you would say is the best time to start yoga if you've not done it before, or a time in pregnancy that you would say it's too late? Is it ever too late?
I want to be clear that I am not trained specifically in prenatal yoga. There are teachers in the area for that. But in the knowledge that I do have about pregnancy and yoga is, first, always check with your doctor. That's the first thing that I want to say. And then once you have that clearance, checking in with the teacher. I know I've had students in my class just up until right before a third trimester. I've never been pregnant. So it's first, second, and third trimester, correct? So
Yes.
Up until third trimester. And there's another things too, that sometimes teachers have ready plans for twists and other things that would be contraindicated for pregnancy, that you wouldn't want to twist into your leg. You want to twist away. So again, I'm not trained in prenatal yoga, but from the brief training that I have and the experience of teaching pregnant students, I haven't felt comfortable because I don't have the experience of teaching someone beyond the second trimester.
I don't practice obstetrics right now with my practice, but as a gynecologist, I do recommend that women who want to become pregnant consider yoga as part of their exercise and care for themselves in preparation for pregnancy, and also women throughout pregnancy. I recommend doing yoga. And Erin, yeah, you also work with a pregnant population who are having pelvic floor dysfunction, pelvic pain during pregnancy. What are your thoughts?
Yes, I think yoga during pregnancy there are certain things that you do want to avoid. There are certain times throughout the pregnancy that you would avoid twists, like Danielle described. And as you progress along in the pregnancy, there's modifications that we make. Would elevate your head. So we're looking at like towards the third trimester, any lying down positions, we would try to prop them up at least 30 degrees. And I think most importantly is the education. It's like, how are you feeling? Making sure that you stay in tune, in touch with your body, into how this pose feels, and no pain. We're not looking for pain. We're not looking for any dizziness or heart rate variability or overheating. I think overheating is clearly one of the biggest things, and that's also going to depend on the client where they were prior to. I believe that you can do yoga throughout your pregnancy with modifications, just like any other person, any other time period of your life with modifications. Certain yoga poses are so beneficial. Just keeping that pelvis mobile and keeping that pelvis symmetrical, because we know that symmetry throughout pregnancy can really help improve like oftentimes the asymmetry or the pelvic kind of shifting that occurs because of the hormonal issues during pregnancy. We need to educate our clients on what does that feel like and what are some things that you can do. So often yoga-based poses are what we use for clients to get them out of those asymmetrical positions. And it can be very, very gentle to do that. And then I think, Danielle, you referenced earlier a couple of times how like we look at these picture perfect, like what you're supposed to look like as a yogi. So I did do taught some of the yoga anatomy for the studio that I did my yoga teacher training at. And one of the first things I said is I gave them what real normal range of motion was. People were so shocked because they're like, oh, that's not as much as we thought it was. It's like, no, 30 degrees of thoracic rotation is within normal limits, right? So this kind of craziness. So clearly with pregnancy, because of the hormones that increase our flexibility, that is a time where we kind of say, let's focus on mid-range. Let's kind of take you to more of these mid-range strength building postures. And then again, depending on the client, where they are in their own body, where they might need flexibility, where they might need some stability.
And I will say this, Hannah, patients that I've had in the past who have done yoga, have made it a part of their life during pregnancy, have carried their pregnancies differently, or have been able to deal with, let me say it this way, the strain of carrying a pregnancy, because it's not comfortable. And as you move on into trimesters, especially into that third, it becomes more uncomfortable. And also, these patients definitely know how to engage their muscles when pushing a lot earlier in this process of pushing, and actually push more effectively. I'm not necessarily saying their duration of pushing is shorter, because that depends on a lot of other things, but their mindset and ability to know where to push and what to do is better. And it's because of their experience in doing yoga, and their experience in understanding what muscles they're engaging and how to engage them. So I think it really does help for the duration of pregnancy, and it definitely does help at time of delivery. And then even those patients I've had that have gone on to have C-sections, their healing process is oftentimes different because of after they've healed from pain, how their muscle support was, how good it was before they had the surgery. So that's helped them heal afterwards. So definitely there's benefit on both sides of the coin with pregnancy and delivery, no matter what delivery you have.
That is so awesome to hear from OBGYN. Thank you for saying that.